Hello and welcome. Thank you for taking the time with me today about your experience with Three Rivers Oral and Maxillofacial Surgery. Can you tell us a little bit about yourself and what you do?
Hi, my name is Norah Ramirez. I am 48 years old. I am from Pittsburgh, Pennsylvania, and I am a sales representative.
Thank you, Nora. So Nora, tell us what brought you here to Dr. Khan, the oral surgeon.
It's a great question. This has been a long time coming for me. This was a decision that was not easy for me to make, and just finding the right person to help me with this journey to get what I needed medically and professionally. I stumbled upon a mutual friend of mine whose husband had work done here, and I was completely blown away with the level of confidence, professionalism, and overall feedback that I received in a passing by conversation, not to mention the level of work. Just amazing what I saw was done for our mutual acquaintance in a conversation. After some deep thoughts and meditation, I decided to pick up the phone and make the call, and that was fall of 2021, and it's a phone call I'm glad I made.
So Nora, tell us about what struggles you were having with your teeth prior to the call.
Sure, I suffer from advanced periodontal disease. My father also had the same condition, ironically, around the same age I was when he went through his experience. And my father had implants done over 20 years ago. So I had an idea what was entailed, but again, 20 years ago, science and medicine has come a long way in 20 years. But walking in the door, I was prepared for good and not so good news based on a consultation, which I desperately wanted to hear the truth, what was going on with my own personal health.
Great. And so when you came to see Dr. Khan for the first time, Nora, what were your biggest challenges or concerns before the implant treatment?
Getting the right level of care. You see a million different ads, commercials, radio ads, websites, get this, get that, instantaneous gratification, but I knew deep down that that wasn't going to be the right fit for me. I knew that I was going to be a more difficult case just based on years of previous examinations and just what I've known over the years, that I wasn't going to have an easy road ahead of me. I don't like to be told no, but I also like to, know the facts before I make a final decision with anything with my health.
Very good points. And what specific fears or concerns did you have about implants before your procedure?
My fear that it wouldn't work for me. That was probably my biggest fear.
Did you also have fears about pain?
Absolutely. I suffer from dental phobia. From years of even back to childhood, I was not a fan of dentists. I've had horrible experiences. I know I'm not the only one who suffers from dental fear. I am the poster child of dental fear. But meeting Dr. Khan and meeting his staff, I've really, I can honestly say I overcome a lot of that. Just by understanding exactly what was going to happen during this process, the open lines of communication. I can't speak highly enough the professionalism of what this group has helped me with.
So how did those fears change when you started working with Dr. Khan and his staff?
They were upfront, completely upfront about everything that was going to happen. I was prepared from point A, point B, point C. I was prepared for every type of scenario possible faced with my health care and what could happen, what could not happen, and just understanding that level of what could be happening to me or not happening to me helped put a lot of that at ease, because I want to be completely educated on everything that's going to happen in this journey.
So you mentioned one thing, Nora. You mentioned that it was a very complex procedure. Can you describe, as you did a few minutes ago, what the full restoration that you had done?
Sure. At my age, I'll be 49 this summer. I suffer from advanced bone loss in my face. I noticed over the years, my teeth were loose. They were rocking, to quote unquote other dentists and professionals I've seen over the years. My back teeth were rocking, so I knew I was just going to advance. I was going to lose my teeth. No matter what I was going to do, this was going to happen. So finding the right person to take on something like this. So upon meeting Dr. Khan, they did a full series of x-rays to see how extensive my bone loss was. And he was honest with me, it's pretty bad. And he said, this is going to be option 1, option 2, option 3 of what we can do here. So of course they removed all of my teeth. Upon extraction of all, and I had them all taken at one time, this was a process, they had to give me full bone grafts in my upper and lower jaws. They basically rebuilt my upper and lower jaw. And then I had immediate dentures put in. And I was sent home. And that's when the healing process began. So over the course of the next 6 to 8 months, I believe it was, and of course COVID was still extra relevant back then too, because I suffered COVID twice during the healing process. I had come in routinely for adjusting of my dentures to make sure I was comfortable with my denture while I was healing at the same time, making sure that everything was healing, x-rays, make sure the bone grafts were healed. So about 8 months after the bone grafts, then the implants happened. And that was a whole other day's work where I had 15 implants put into my upper and lower jaw based on how my jaws were healed.
Could you show us a little bit?
So then upon that, they went back into a temporary set of dentures. I had temporary, mine were never snap in, snap out implants. So once the implants went in, they were fixed bridges. That's what they're called. So with the fixed bridges, that was to make sure that everything was locked into place. And they're aesthetically not what I have now, but I have teeth. So the entire time I never had that mental anguish of, oh my goodness, I'm toothless, or oh my goodness, what does my face look like? That was a big thing for them. They wanted to make sure, especially with my line of work, because I do face-to-face sales every day, that I had the confidence going forward, especially after everything. There's a lot of trauma to have everything removed and then getting those implants. And your face changes, my face has changed a lot in the last year and a half, since start to finish. So after you have your temporaries, they want to make sure everything heals. Unfortunately, I had 2 implants fail, which I knew, again, I was completely educated during the entire process, but Dr. Khan was very cautious. He's very cautious and errs on the side of caution when it's work. So we had enough implants to, even with 2 removed, extra healing happened. And then when my finals went in, right before Christmas, best Christmas gift I could have had, everything was good to go. And I've had my permanent set now since December of 2022. And I couldn't be happier.
So how have implants improved your life, Norah?
Confidence. I'm a confident person, but my goodness, just to smile. I would hide my teeth or half smile a lot, but now I'm grinning ear to ear now, and I get a lot of compliments. Oh, wow, your smile's so nice. And people that don't know me don't realize that these are implants. They think they're my natural teeth because Dr. Khan didn't want me to have an unnatural smile. Neither did I. To each their own, but my teeth look natural, they feel natural. I'm able to eat, I'm able to bite an apple, which I wasn't able to do for over 20 years. It's the small things that really just make me smile, no pun intended. But again, it's the best thing I ever did. I'm glad that I took the time and I didn't rush my decision, to be honest with you.
Would you do it again?
Absolutely.
Would you recommend Three Rivers Oral Maxillofacial Surgery and Dr. Khan and his team?
And I have. Only because my friends who have had similar stories or frustrations, they know the name, they know the number, they know where they're located, just because the work speaks for itself.
Thank you so much, Norah.
You're welcome. Thank you.